restate what I said before. I'm like giving a lecture here on YouTube. So blood comes up the aorta and it goes into the right coronary artery or the left main coronary artery. The left main bifurcates or kind of splits into the circumflex artery here or the LAD. The LAD is, after the left main, is the next most important vessel. It supplies the front of the heart. Probably over 2/3 of the heart is supplied by this in some people. And it goes to the front of the heart, and it's the so-called widowmaker. Okay? If there's a problem with the left main or the LAD, patients get into problems. So, one other thing that we're now learning more about is that the way that the coronary arteries work, so if this is a cross-section of the coronary artery, right? So if I were to cut it like that, what happens is you first will form a plaque here in the wall, right? And then the plaque will actually go outward as to protect the inside of the vessel. It's just the way that we were made. And so what has happened in many people is that this plaque gets big and it can't keep going out that way, so then the next thing it goes into the vessel and it can cause blockages. The coronary CT angiogram shows heavily calcified blockages in your case. Heavy calcification. So that's blockages, and those blockages are located in both the circumflex and in the LAD. It's a little bit challenging because of technical reasons to determine if all of that plaque is outside, like so, or if it's actually impinging on the lumen here. But there's severe disease in those areas.
You say I have severe disease in those areas?
Yeah.
Okay.
And so what I think it looks like if we were to actually do a cath is that in this area, I think it looks something like that. Meaning that I think there's a big plaque that's just sitting right in this area. Does that make sense?
Yeah.
Now, one of the other physicians who was reading the study said, well, I'm not sure if it's mostly out here or if it's actually more in the lumen here. So that's where they gave you that persantine, and they tried to determine, is this area down here not getting enough flow? And that study is not really ready for prime time. It's not a clinical study. That study is called, I'm going to write up here so you remember, it's called CT perfusion. Again, it's not, we don't have tens of thousands of patients to base it off of. So the data is not really clinical, it's more of a research tool. So I think that there is a potential problem there. Now, the problem that I'm dealing with is the location. Because, remember, I told you the left main is important, the LAD is important. This is in the beginning part of the LAD. And if there is a severe blockage there, even if you're not having symptoms related to it, then there's a survival advantage, meaning you're going to live longer if we go in there and we fix it. Because of the location. It's actually the first 5 centimeters of it.
Okay.
So what I've recommended is that we deal with this tomorrow morning.
Okay.
With a heart catheterization.
Okay.
Okay? Because then I will be able to tell you definitively where that plaque is, how severe it is. There are other tools that I can do to determine if that needs a stent or not. I won't put a stent in there if you don't need a stent. But if you need a stent, I'm going to put a stent in there. Okay?
Okay.
The way that we do those procedures is through the wrist. It's called radial. You go through the radial artery, which is an artery here where you would wear your watch. Numb the area there, and we go up and we put our catheters up and around through this vessel here into the aorta. We have our catheters here, we put them in there, we inject contrast, and we see if there's a blockage or not. If there is a severe blockage right here in the LAD, we'll fix it right then and there through the wrist. We don't take you off the table and talk to you or anything like that. We say, hey, we got a blockage, we're going to fix it.
Okay.
If you don't need it, we don't do it.
Okay. Sounds good.
Sound like a plan?
It's a great plan.
So,
Okay.
Is your
And,
headache getting better?
Internal medication.
No, it's still
yeah,
killing
they
me.
are making it and they're going to do.
where
They
is
want the